All right, some medical news now. A new study reported in the New England Journal of Medicine suggests that the vast majority of torn meniscus knee surgeries are actually ineffective. About 700,000 Americans undergo this operation every year at an estimated cost of $4 billion. Joining us now is Dr. JEVSEVAR, a spokesperson for the American Academy of Orthopedic Surgeons. Thanks so much for joining us today.
Thank you for having me.
First of all, what type of knee surgery did this Finnish study, it happened in Finland, really look at? And how many people were involved? And what did the researchers find?
So first of all, I have to really applaud the surgeons from Finland who did this study. It would be a hard study to reproduce in most countries, including the United States. So what they did was they took 150 patients or so and randomized them or put them in two different groups. All of these patients had a meniscus tear on the inner portion of their knee. That was confirmed by both examination and by an MRI scan. They were all symptomatic. And on half the group, they did an arthroscopy and looked at the torn meniscus, characterized it, or torn piece of cartilage and characterized it, but they did nothing further. On the other group, they did what would normally would do is that they did an arthroscopy, characterized the torn meniscus, and then removed that torn piece of cartilage. And what they found was that the result of just putting an arthroscope into the knee, doing the surgery without removing the torn piece of cartilage, was the same as removing the torn piece of cartilage.
Interesting. And we know that, we're looking at the video of the actual surgery there, the arthroscopic. They can go inside and do it very quietly, if you will, in ways that although it doesn't look quiet right there. Anyway, the bottom line is that some people this surgery seems to work better for than others. And that somewhat has to do with age, does it not?
It has to do with a number of different factors. It has to do with whether it was an injury or a traumatic cartilage tear versus a degenerative tear. So this study looks primarily at degenerative tears, which generally, as you can imagine, would be in an older age group. These are meniscus tears that may or may not have occurred originally with the injury, but have been present for a relatively long period of time.
So what kind of activities does a torn meniscus affect actually in the first place? And what sports activities, if you will, does it affect?
So typically it would be anything that requires cutting or pivoting or even squatting. So people that have a degenerative meniscus tear, they may just be squatting down to tie their shoe or to bend over and put their socks on, and that can give them discomfort. But typically we see it more with activities like running or jumping or things like that, or lifting weights. Typically less common with people that ride bikes or people that swim, but it can occur in those activities as well.
And they talked a little bit about the fact that physical therapy can also be effective in helping to repair some of these medical issues that people have with their torn meniscus. Is that not right?
Yes, there was actually a good study done by Dr. Marks, actually, at Hospital for Special Surgery there in New York. And they compared physical therapy with surgery and found that in a large number of patients who also had knee arthritis, that physical therapy was as effective as doing surgery in that patient group as well.
So my mom's a doctor, and I kind of know how this works, right? If you are a specialist, for example, you want people to be able to refer people to you to do a surgery or so that you can conduct your specialty. But of course, you don't want to have people getting surgeries that they don't necessarily need, correct? So how does that work and balance out? Because if there are people that are getting surgery that don't need it, is that sustainable for somebody's practice?
Well, I think that the one thing that some people may gather from this study is that we're just willy-nilly doing surgery in all patients that come to our door. And I don't think that's the case. I think that for most orthopedic surgeons in our country, the treatment for somebody that would present with an injury like this or with pain or symptoms from a degenerative meniscus tear, most of us would do a course of conservative management, and that could be anti-inflammatory medication or physical therapy or injections before we would proceed with surgery. So I do think it's relatively rare that surgery is the first option that an orthopedic surgeon would throw out for this condition.
All right, Dr. JEVSEVAR, we thank you so much for your time. We appreciate it.
Thank you very much.
All right, well, just a note that today is, in fact, the first day of Kwanzaa in the United States. So we want to say Happy Kwanzaa to those who celebrate. Thanks so much for watching Arise America, and we'll see you tomorrow.